Good morning. This is Dr. Wael Aboughali. I'm a family physician. I've been a family physician for 21 years. Today I'm joined by two patients, one current and one former, Kim Crespo and Priscilla Gonzalez. I'd like to introduce each one of them and would like them to say something about themselves and let us know how we met. I'll start with Kim.
Well, we met probably 4 years ago when I saw Dr. Aboughali at the Baytown Clinic, and he became my doctor then, and for about 4 years, and just was very impressed with him, and just can't say enough nice things about him.
And Priscilla?
I met Dr. Aboughali at the Baytown Clinic as well. I loved his dedication to what he was doing and his persistence. He was very helpful, very open-minded about things, very kind-hearted.
Walk us through the experiences that you had at Baytown Health Center with the nursing staff there and how we interacted there when you were being scheduled and trying to go through your problems over there, Kim. How did I help you solve or what you were looking for at that time?
Well, anytime I came in with a medical problem, you always addressed it so well as far as if I needed any kind of testing or, whatever I needed, you were there to provide exactly what I needed.
And how did that make you feel?
Very comfortable and just secure, very secure.
Good. And when you progressed through Harris Health and you learned the system better, how was it helpful to you to have a doctor who would listen to you and navigating that system?
Well, it was just so good to have somebody that had so much knowledge about the system that could teach me about the system and how to navigate through it. Again, it was just a very comfortable and secure feeling to have somebody that could help me with everything that I needed.
And for Priscilla, how did we meet?
We met at the clinic as well. You were just a random doctor that my mom had made an appointment with because she knew that there was stuff going on with me. And then I didn't think that I was going to keep you as my doctor. But then my mom started noticing how dedicated you were to helping everybody and how you went above and beyond. And then from there, my mom was like, yeah, we're going to keep this doctor. So
Give us an example of what you mean by above and beyond.
So you would help me in ways that other doctors wouldn't. You would actually sit there and listen to the problem instead of just yeah. Okay, I'm gonna give you this medicine. This should help. Instead, you would find a solution. If that solution didn't work, you would go on to another. And if that solution didn't work, you'd find another one for me. So
Sounds like a very persistent guy.
So how did you end up finding Dr. A?
I found him. I didn't find him. My mom found him actually. Just Googling doctors, and I think the first time they just sent me to a random. My mom's like, "Well, this is what's going on with her. We need to make an appointment." And from there, they just said, "Okay, well, this doctor's available. I'm gonna hand you over to this patient." To this doctor. So that's basically how it happened.
And over time, we've actually become friends. So many of my patients become my friends. The ones that stay with me for a long time, 3-4 years, we eventually become friends. I have a saying. This is welcome to my clinic, enter as patients and leave as friends. Because I want the family medicine relationship with patients to be friendly. It should be friendly. It shouldn't be difficult. It should be comfortable. It should be easy. It should be trustworthy. It should be compassionate. It should be empathetic. You should be heard. It should be honest. and it should be grateful for each other, not just for yourself. I get a very special feeling when I help someone and they tell me this worked, and like my heart soars, really does, when I hear people doing well, because I don't want people to suffer unnecessarily. Everybody will suffer, but not everybody has to suffer unnecessarily. And then, part of living is going through suffering, right? We have to suffer some to learn, right? You learn more from failure than you do from success. And I try to instill a sense of confidence in patients, and a sense of faith and spirit, that things are going to be okay. We're going to still look for the solution. Might not always find the perfect answer, but we can certainly do things to help you feel better, even though we don't necessarily have the right answer today. With patience and time, and willingness to serve, the dedication to practice becomes evident. And I think for my patients, I try to show that, every time.
With Dr. A just saying what he just said, how does that make you feel?
Well, everything that you just said is what makes you so endearing to us and what makes us feel so well taken care of. And I mean, you go above and beyond with that. Your bedside manner is amazing. Like I've never felt that with any other doctor before in my entire life.
Thank you.
It makes me feel very warm inside.
Yeah, me too.
Because that's just how you are as a person. There's no changing you. You have a really big heart of gold. And it shows by the way that you practice medical.
What I was saying to Osman is my medical student. And what I was saying to him earlier today is that, we look at today in this instantaneous gratification culture, that things have to happen today and tomorrow. They don't. They don't have to happen that quickly. Change takes time, right? And people need to accept also that physicians need to take their time in order to diagnose properly and be able to give you the right treatment at the right time. Timing is a very important part of it. And also, this isn't an 8-to-5 job. This is a constant changing job where physician and the patient are always interacting. We're in a very high technology system now where patients can text their doctor, and they should, right? If they're not feeling well, they should be able to text into the electronic medical record and portal and be able to access their physician. And physicians should respond. They should reply. We should, because patients deserve it, right? I don't need to wait 3 months before I find out a medicine's not working, or that the patient can't get through to me through my secretary, and I don't get the message for 2 days. Patients should have access to their physician. We should all do a better job making sure that they have that access. How does that make you feel when we talk about access?
Well, I've always had good access with you because, I am able to text you. And there's been a couple of times when I was ill and you called me on a Sunday morning and to check on me. You just don't get that. You just don't get that out there anywhere. And I love being able to have the access to reach out to you and have you respond to me quickly. It's just, it's a wonderful feeling to have a doctor like that.
Does it remind you of how medicine used to be?
Yes.
How long ago?
When I was a kid.
So I think this is what medicine should be again, and how it was 40 or 50 or 60 years ago when the family physician went to people's homes and used to deliver babies for people and used to sit around the dinner table and talk with them. So how are you? Heaven? It's nice to meet you, Janet. It's really nice to see you again after, here's a little baby Billy. And there's Priscilla in the corner, playing with her doll. And it's really nice to see you guys. That's a family. That's what a family physician should be like. What do you think, Priscilla?
I think it's amazing that I can text you. I have access to you whenever I do need you. There was one time where I started a new prescription and he called me just to make sure that I was doing good and I was okay. And I was, in my head, I'm thinking, this man cannot get any better. It's the best doctor ever. Literally.
Thank you.
Dr. A, with them saying what they just said about you, how does that make you feel?
It makes me know that this is my purpose, that I picked the right career and occupation, that my dad, when he told me to go into medicine, he did me the biggest favor he could. It's a genuinely wonderful feeling to know that people care about you as much as you care about them, you know, and that shows. The gratitude shows. And you replace, I don't need to do this for money. I'd rather do this for free. I really would. But everybody has to make a living, right? But you can do it in such a way that the people who surround you are a good reflection of you, and that you're a good reflection of them. And keeping those bonds and ties close, you know, so that we're a community, you know, that cares about each other. And when you do an act of kindness, when you do an act of patience, an act of integrity, that person feels good about himself and will take that and do it for somebody else. And he'll carry it forward. And step by step, person by person, you change things. Slowly, but it will change by having the right mindset.
The way that you run your business, Dr. Aboughali, is that the same way you are all around, at home, everywhere you go? How do you keep such a positive outlook or a caring outlook in your daily life as well?
That's a great question. I think in the morning I pray. You know, I pray my spiritual self. I pray to God to be optimistic, to be grateful, to be kind, to be compassionate, to be empathetic, to be sympathetic, to be humble, to be patient. And every morning I start with a prayer, and every night I end with a prayer. So that the first thing I do in the morning is remember God, and the last thing I do is remember God. He gave me my first breath, and will take my last. So I hope that he gives me enough strength not to make a mistake, and to be a good guide for people. So yeah, it's me most of, except for the times when I'm very disorganized at home. Well, with my wife, mostly, I'm this way most of the time.
What about him really resonated with you when you first got there? Maybe some reservations you had about seeing yet another physician, and then at the end of it, knowing that he was the physician for you.
So because he was a male doctor, it was a little uncomfortable, because growing up I was used to just having a female doctor. But what set him apart was that he was very persistent, and regardless of how many times I stopped going to visit him, how many times I wouldn't take my prescriptions, wouldn't do what he would ask me to do, wouldn't exercise, he would still push me and tell me, hey, let's do this. Let's get you looking healthier, feeling better. And because of that, I continued to go to him, because nobody has ever been that persistent with me. And that really stuck with me. He made like a little trail in my heart, so...
It's a good trail.
Yes, a good trail.
We use it often.
Well, I didn't really have any reservations. I don't get too nervous going to the doctor, but I liked him from the get-go. From the first time I met him, I liked him. I could feel what kind of person he was. That shines through. He can't hide that. So, I liked him from the beginning, and I felt comfortable, and I knew I'd be going back to him again, because he was that special, and I could feel it. I could feel his sincerity. That's something else he can't hide.
I would explain him to anybody that needs a doctor as very compassionate, very flexible, very understanding. He's a problem solver. Maybe not right away. So I would definitely tell anybody that maybe he won't get to the solution right away, but he will eventually. And I would tell them that, I mean, his office, when you walk in, you feel comfort. It's not a cold office like usual. You feel like kind of like a home, like a grandma's house. You know, when you walk into your grandma's house and you feel that warmth,
Yeah.
that's how it feels walking into his office. So explaining that to somebody, I mean, that's more than enough right there.
Well, I've already told all my friends about him. I mean, you know, I sing his praises all the time. You know, I've told them how, you know, he calls me, you know, to check on me and they can't believe it. And so, you know, I would just tell people that you just can't go wrong with him. You're going to love him. He's the best.
And he's very affordable with his new plan that he just came up with, the membership. It's an amazing membership, so.
Dr. A, you want to explain that?
Yeah, so we are part of a movement. I say we as family physicians. The younger generation of family physicians are coming out and looking at the landscape and saying they want to have close relationships with people. They don't want to be part of systems as much as they used to. It's a direct pay model where there's no third-party payer. There's no insurance companies. There's no copays. There's no deductibles. There's no confusion. There's no bills that come after you. There's no medications that you can't afford or tests that you can't do because it's too much. You know, we created a membership plan for individuals and families that you can afford. It starts at $125 a person. For that, you get 8 to 5 unlimited care, primary care, when we're open. We're not an urgent care or an emergency room service, and this is not an insurance plan. But it is all the primary care that you need, as often as you need it, through text, through communication, through phone, through televisit, through in-person visit. You can call and schedule, and we'll see you the same day or the next day if possible. We'll do our best to accommodate you. And through this membership, you are essentially trying to determine access. This is really for people who have chronic conditions, diabetes, high blood pressure, heart disease, and people who want to just have safety, feel well. People who suffer from anxiety, migraines, depression. This is good for them. And there's a behavioral therapy component to it. And you get time with the physician, extended time, 30 minutes each time, 60 minutes initial consultation, and basic labs once a year. Everything that I can do in the office, strep tests, flu tests, pregnancy tests, urine dipsticks, Toradol injections for pain, for severe pain, steroid shots, allergic conditions, nebulization treatments. I try to do is included in the membership. How does that happen? Why do you do it like that? Because we want to provide affordable care and really connect with people. We want people to see that medical care is affordable. It can be done. If a community of people cares enough about the physician and the physician cares enough about people, that they respect each other and don't overutilize care and get the care they need. You don't have to run out of medicine and run to an ER and wait there for 6 hours just to get a prescription filled. You don't need to do that. You don't need to pay $600 at an urgent care because your son has an ear infection. You can't get into his pediatrician's office. You don't need to do that. That doesn't need to happen in our society. We just need dedication from the physician and from the patient. You're going to use this doctor, and this doctor is going to help you. And that's how it should be.
That sounds amazing. I might sign up.
Oh, I hope you like it.
I'm sure I will.
Oh, it's part of the plan also. The medications can be delivered to you whether you have insurance or not. That I have pharmacy partners who can deliver medicine to your home. So if you are elderly or if you are impaired or disabled, we do have ways to get the medicine to you. And if you need imaging, we do have partnerships with imaging centers to keep the cash pay prices reasonable. And you don't have to worry about the cost of blood work that much because it's very affordable too. So we've designed this system to answer as many questions as we can, and to help people as much as we can. And I do have a network of specialist physicians who collaborate with me, who give cash pay prices. So I really encourage people to engage a direct primary care doctor, whether it's me or anyone else. This movement is going to hopefully change your life and make it so that you have a good connection with your doctor again. Because those doctors doing direct primary care, they're outstanding.
I do have a question. You said that, so if you have insurance, do you take the insurance?
You can use your insurance for labs or imaging, but I don't. We don't use the insurance for the visit, for the pay visit. So if you do the membership, you can't be on Medicare or Medicaid or a government-sponsored plan because it is not considered a government an insurance plan. So we are excluded from those plans. So you can't use the plan, like a prescription that I write you won't be paid for by Medicare, Medicaid, or government plan. So you'd have to pay cash for it. But I don't write expensive medications. I don't write things that are crazy expensive, And if you have insurance and you're not one of these plans, your insurance can pay for that, can still pay for that. Okay. Yeah. So you can have the best of both worlds. You can use your insurance for hospitalizations and for specialist visits, which cost more. And you can use the membership for all your primary care, which can address probably 80 to 90% of those people's needs. So if you couple those two, you can use a high deductible health plan. If you have a high deductible health plan, that would work very well because you have to pay up into it until a certain amount is met. And then the plan would take over. So a lot of people are turning to high deductible plans now because it's very expensive. And this is a very good way of having insurance and having primary care.
Okay. So you just offered the membership?
I just offered it. I just started it. It's starting in November.
And that's what you're going to be doing?
And that's what I'm going to be doing.
Okay.
How can seeing a family physician regularly improve someone's overall quality of life?
I'll go first. Mental health. Seeing a doctor is something that you definitely need to see, that you have to see whenever you are going through things. And especially Dr. Aboughali, with the way that he is, it makes you want to go to the doctor. It makes you want to actually get the help that you need.
So what did we do last week together, Priscilla?
Oh my God. We actually started that new what is it, where it records our voices.
We started a AI integration, artificial intelligence scribe that we're testing out, and we're a pilot for this new one that's coming out called Sporo Health. So we're testing the pilot, and we were shooting. Priscilla was one of the first people to see it. How did you like it?
I did like it. It summarized our whole visit. It was awesome.
Yeah.
We also did the body mass.
We did like a body mass composite index, composition analysis.
That one was awesome too. It showed me how much weight I actually need to lose, how much my skeleton weighs. It's pretty cool.
Sounds like it.
His office is coming tech savvy, and I'm trying to catch up. The other day, he did a little EKG with my fingers, and usually the EKGs are like all over your right. So I was kind of shocked when he pulled out an EKG. I'm like, what is that? How is that possible?
We are trying to harness the power of advanced technology and being a leading clinic in Houston to harness technology and make the user experience better, safer, more efficient, and allow the patient to be able to be involved in his own care, to be able to see the metrics that are his own body metrics, so that you can gauge improvement over time. You can say, okay, Dr. Aboughali, we did this, and I'm losing weight, and I can see it. I can visibly see it. And I feel better, and I can see why, right? Because it's all measured. We're not just looking at blood pressure and heart rate. We're looking at body mass index. We're looking at skeletal mass. We're looking at respiratory rate. We're looking at SpO2. We're looking at all the things. We look at your basal metabolic rate. We look at your salts, your water, your hormones, your all your blood tests. We do all of them. We do 18 panel blood tests when you first come, so that you can know exactly where you stand. And by being really thorough in the beginning, we can accurately gauge your health. And we give you a score of how your health is. And then we try to make that score go up.
That sounds amazing.
We think we're really trying to push the envelope of what can be possible. And we're always testing new things, to see what works and what doesn't, and how do we integrate it, and how do we make the patient see it.
Well, the weight loss part is something that I've been dealing with ever since I went into menopause. And this sounds like something that I've been looking for years, to help me with my weight loss, because I've tried everything and I don't get many results. So that sounds pretty interesting to me.
Yeah, we can definitely talk about it, see what solutions are out there.
Okay.
And doctor, what screenings or tests do you recommend that most people don't know they need?
So most people know about breast cancer. Most females know about breast cancer. Most people know about colon cancer too, right? Now colon cancer screening has actually been reduced from 50 to 45. And that's because we've seen a high rise in the incidence of colon cancer in young men and women. We're seeing it as early as 40. This is highly due to the type of foods that we eat. A lot more processed food, a lot of red meat, And so the screenings are coming out even earlier. The other one that are common that people don't know about or don't think about that much was pap smears, cervical pap smears, right? So the recommendations are age 18 if sexually active, and then 21 regardless of activity. But we recommend vaccination for HPV, the virus that causes cervical cancer. And if you go with several years without having a test, a pap smear, you could be already in advanced cervical cancer because you can't feel it, right? It's in a place where you can't touch, and you don't feel anything, and there are no signs or symptoms. So that is a very silent cancer that can go undetected for many, many years, and it's a very slow growing cancer. So people feel fine, right? And then all of a sudden they're 25 years old and they have cervical cancer. So it is something that's very important to screen for. Those are, I would say, would be the top two that people don't think about too much. And then prostate cancer for men over the age of 50, especially African-American men. Detection of prostate cancer.
What's the most important health habit people can start today?
Exercise. Because it's easy. You can do it. You just get up, walk around, and that's it. Simple. You don't even you can go to McDonald's and walk there, right? Even if you don't change your health habits, I think the easiest one to do is exercise. The other one, stop smoking. That's a very easy one, right? You just don't buy it anymore, and I know it's addiction and I know it's difficult, but those two things, if you stop smoking, the leading cause of death in America and actually worldwide is heart disease, right? And smoking accelerates that profoundly, that and diabetes. So if you're going to pick two things to stop, let's say smoking and eating and carbonated beverages and fast food, those two things, if you just did those two things, you'd lose weight and you'd feel better. Within a year, most of the lung function that was diminished returned from the smoking. So you can recover completely, provided that you didn't develop really severe disease from it. Then I would say eating well, sleeping 7 to 8 hours a day, and reducing your stress. But I think exercise would probably be the easiest one to accomplish. The recommendations currently are 45 to 50 minutes, 5 days a week of exercise.
If you both were to write a review on Dr. A, what would it say?
Basically, I said what I've said here today about Dr. Aboughali, that he's top notch. You won't be disappointed. He's just helped me so much, and just, I guess, everything I've already said.
Same, that he's amazing, that he's good at what he does, and that I would highly recommend him.
Thank you, Kai.
Thank you so much for helping me and for being a great doctor to me and a friend.
You are most welcome.
Same thing.
My pleasure.
Just amazing doctor and an amazing friend, actually. And I hope your heart never changes, and I hope your kids grow up to be the exact same way as you, so that there's more love in this world that you give everybody.
Thank you. I'm so touched.
So, Usman Ali. Dr. Aboughali is a really good friend of my dad's.
And you.
And mine too now. So basically this started around Hurricane Beryl, where lights were out and everything. And my mom and sister had, I forgot, it was some cat-related issue that we had from the scratches. So Dr. Aboughali's office, what I noticed really was his office was, lights were out, but he still invited all of us into his office. And my mom and sister were instantly impressed by the doctor, which me personally, I'm not impressed by people instantly, but the way my mom was talking about him, it was something else, because she's not normally comfortable with like other gender or anybody else. But the reason I got impressed by doctor was because the writing on your wall, whatever it is, it's actually you, and you can actually see it reflected when he's talking to you, how he is. And one other thing, how he goes above and beyond. You took us in your own personal car to the lab to get blood tests, which that's actually very considerate. That's like you're actually treating your patients as your friends, as like you're not doing them a favor. You're actually concerned about them. And you drove us there, drove us back, and you actually like jokingly said, if you want to work with me, you can. And I remember I texted you around like Friday, 12 a.m., a whole essay, and then I got a response on Monday. And then I got my dad's approval, and then I started like coming over here as a student. And my experience with you actually throughout the 3 months, seeing the patients, the meetings we had with the doctors, going to different places, here also, and of course, the stuff that you've taught me, the medical conditions, it's like knowledge that stays in my brain, Not all of it, obviously, but the stuff that I've written down, I really learned from that stuff, and how your mindset is. I think I told you this before too. I've learned more about life and philosophy, more than medical stuff, and something that I really like. The reason I keep coming every Tuesday and Thursday to you is because of your mindset. All the stuff that you've written on the wall, especially that one, even my patients has patients. Some stuff that you do, it's like, I want to give an example. I think this is one time something happened, and you said, maybe that's not meant to happen. Maybe we weren't meant to meet that doctor or something. And that just stuck with me because I would have been very, very angry. I would have.
Let me give a context to that. Yeah, so that people know what we're talking about. So I had made an appointment with a doctor, and he was very far away. And I had previously not been able to meet him. So I had canceled previously, and I rescheduled. And because it was 45 minutes away, I tried to be on time, but it was right after Friday prayer, and I don't miss my prayer. So I went after the prayer, and I called and told them, can you wait for me? I might be late 10 minutes or 15 minutes. And because I'm coming a long way. And then I showed up, and even though I had told them that the doctor had left, and his office said, you can come back next week. And I was not going to come back because I had called and said, I was going to be late. Can you please wait for me? And so on the way back, I kept thinking about, how am I going to behave? Why did he do this? I kept thinking about, why did this happen? And then when I got to the office again, about an hour later, we talked about it, me and Usman. And I said, was I wrong? Did I do something wrong? And we said, no, we did the right thing. We talked it through. We did the right thing. We called ahead. So maybe it just wasn't meant to be. That some things are beyond your understanding, why they happen. There are some things that happen to you that you can't explain. Maybe God has an intention for you. We say in Islam, لا تكرهوا شيئا لعله خير لكم. Don't hate something that might happen to you because it might actually be good for you. Because if your intention is good, then you didn't do anything wrong, right? God just didn't intend that thing for you. If you knock on a door and it's closed, and you keep knocking and it's still closed, it's going to stay closed. It's not meant to open. It's not for you. So stop knocking. Move on. And sometimes we get stuck in that frame of mind of, if I had just done this, we live in regret. We keep looking in the back mirror. You're in a car, you look in the rear view mirror. You know what's in the rear view mirror? The cars that you passed already. You're going forward. Stop looking at the back. Doesn't matter. It's over. Keep moving forward. Right?
Mm-hmm. Yeah. I like how even in the beginning, the lessons you would connect it to Islam. And as you said, you start your day by doing a prayer, and you end your day by remembering Allah too. You're doing the prayer. And I see you sometimes reading Quran, like even right now before the talk, you were doing your prayer, which I really like your mindset and everything that you have, even behind the scenes, even when you're not talking to a patient. That part of you is just, I tried, even in my personal life, in school campus, that actually, I would say it leaves an impression on me. I really like the way you think, basically. The way you move through your life, through your day, through the problems that you encounter. You're always remembering Allah. You're always humbling yourself. You're always self-checking the doubts that you have, the questions that you have about situations. They keep you humble, and I think that's a good trait in a doctor. And I really feel like the more I stay with you, I would like to become more of a doctor like you, because if I went to a different doctor, if I started working, I would have had his mindset, and I'm grateful that I have a mindset like yours. And going forward in medical school and anything in my life, basically, it's gonna really help me my life from your experience working with you.
Yeah, thank you. In my office, there's a sign when you enter. It says, I will be patient until patience itself loses patience with me. So, one of the things that we do as physicians, we have to wait for things to happen. And the things don't occur on their own. We believe that we move things. We don't move things. People move things, but we help patients get to a point where they accept what we say. I mean, that requires building trust. So you have to remove the doubt, and that's only by building successful communication with patients, for them to trust that you have their best interests in mind and nothing else.
Yeah. Also, one more aspect of the behind the scenes is the great care you're taking of me and your patients in general. The gifts I think he gave, like Priscilla. Yeah. I guess he actually treats everybody as a friend. That's what I like about you. You treat me, any of your patients, and that's a good trait that I would like to get off of you, working off of you.
You have to always believe the best in people for people to have the best in themselves. You don't wait for somebody else to make the first step. Take it. Take the first step. Like when you go to Starbucks, there's a line. Pay for the next guy behind you. Show an act of kindness. Let him start the roll. Let the next person pay for the next one. Start it. You don't have to wait for other people to introduce themselves to you. Introduce yourself. We say stay away from strangers, but everybody's a stranger until you introduce yourself, right? How does anybody become friends if everybody stays away from strangers, right? So we should enjoin to get to know people, cautiously. Yes. So my website is mydoctorprimarycareclinic.com. I'm at 9330 Broadway Street, Suite P306. I'm in the StarTex Title Building. I've been there for a year, and my phone number is 832-920-0967. And I see ages 18 and above. I do all of primary care, and I enjoy it.